How to fix low back pain instantly with stronger scientific backing. Low back pain affects over 80% of adults at some point, often due to poor posture, muscle imbalances, or prolonged sitting. Here's a quick, evidence-supported routine to reduce tension, improve spinal mobility, and restore better alignment in just a few minutes, plus deeper why it works explanations. As always, if you get pain radiating to your leg, numbness, or persistent worsening, see a clinician. Step 1. Reset your posture, approximately 30 seconds. Why it works, enhanced. Intradiscal pressure, IDP, studies by Nachemson et al. And subsequent replication show that unsupported sitting increases disc pressure by 40% relative to upright standing, Lippincott journals. Reclining or posterior support can reduce disc pressure by 50 to 80% compared to upright, Lippincott journals +1. More recent reviews show that posture, slumped versus erect, significantly changes lumbar loading. For example, slumped sitting strongly increases pressure on disc structures versus erect sitting, MDPI +1. Additional work shows that posture influences spinal load via bending angle, external force, and body configuration, PMC. All of this supports why small postural corrections, keeping the spine more neutral, less flexed, can reduce stress on lumbar discs and musculature. How to do it? Final version. Stand tall, feet hip width. Roll shoulders back and down, opening chest, not forced. Slightly tuck chin so your head is stacked over spine. Avoid jutting forward. Gently engage glutes. Draw navel inward, but allow breathing. Softly lengthen the spine. Imagine a thread pulling you upward. This reduces compressive load on lower lumbar segments and reactivates your core stabilizers. Step 2. Cat-cow spinal mobilization, approximately 1 minute. Why it works, enhanced. Alternating spinal flexion extension, cat-cow, helps unload different lumbar segments, improving segmental mobility and possibly enhancing fluid exchange in intervertebral discs, nutrient flow. In manual therapy and movement therapy literature, gentle spinal mobilization is used to reduce stiffness, improve range of motion, and reduce pain sensitivity. While direct high-quality RCTs are fewer, the biomechanical rationale is accepted. More broadly, motor control and movement variability are considered important in low back pain. Rigid, static postures contribute to pain, whereas gentle, dynamic movements help maintain tissue health and prevent immobilization. jospt.org/2ScienceDirect. How to do it, refined. Start on hands and knees, neutral spine. Exhale, draw navel upward, round your back, cat. Inhale, arch the back, drop belly, tilt pelvis, cow. Move slowly and smoothly between the two, doing 8 to 12 controlled reps. Avoid forcing extremes, stay within a comfortable range. Step 3. Seated forward rock, approximately 30 seconds. Why it works, enhanced. The hip joints play a major role in low back biomechanics. In those with low back pain, hip mobility, especially rotation and flexion, tends to be reduced, and hip muscles, extensors, abductors, are often weaker. Biomed Central +2 Science Direct +2. Because limited hip motion forces the lumbar spine to pick up slack. Promoting hip mobility helps offload the lumbar area. Gentle rocking, anterior-posterior at hips helps stimulate hip flexibility, reduce compensatory lumbar motion, and remind the system of proper hip-pelvis coordination. How to do it, refined. Sit at the edge of a stable chair, feet flat. Keep chest tall, hinge from hips, not bending your lower back. Rock gently forward to back, 10 to 15 times, slowly. This helps restore hip-lumbar coupling. Step 4. Standing pelvic tilt sequence, approximately 45 seconds. Why it works? Enhanced. Pelvic tilt control is central to coordinating lumbar pelvic motion. Poor lumbo-pelvic control is often found in those with chronic low back pain. PMC+, Science Direct, +2. In a study, individuals with low back pain had poorer postural control and lumbo-pelvic control measures, which relate to function and pain intensity. PMC. Motor control exercises targeting deep stabilizers, pelvic control, are supported by clinical guidelines and meta-analyses. Though effect sizes are modest, they are a key part of many conservative LBP protocols. jospt.org/sciencedirect/2. Improved pelvic control helps reduce undue lumbar shear, torsion, or extension forces by distributing movement more appropriately across the spine and hips. How to do it refined. Stand, ideally with your back near a wall, but not forced. Perform a posterior tilt. Flatten your lower back gently into the wall or toward neutral. Then transition to a slight anterior tilt, small arch within comfort. Repeat 10 to 15 slow, deliberate reps, focusing on smooth control. You're training your nervous system and musculature for better alignment control. Step 5. Knee to chest stretch, approximately 1 minute. Why it works, enhanced. Flexion at the hips and spine can slightly decompress posterior elements of the lumbar spine, relieving tension in posterior soft tissues, erector spinae, posterior ligaments. Intradiscal pressure models show that flexion extension, positional change, and movement all influence disc load. By gently flexing, you may reduce local compressive stress transiently, though flexion mustn't be forced. Because tight posterior chain, glutes, hamstrings, back extensors can contribute to resistance to lumbar flexion, this stretch helps release some of that tension. How to do it refined. Lie on your back, knees bent. Pull one knee toward your chest, holding gently for 20 to 30 seconds. Switch sides. Optionally, hug both knees, gently rock side to side for additional relief. Keep breathing. Go only as far as comfortable. Bonus, core activation. TVA and pelvic floor, this is 30 seconds. Why it works, enhanced. The transverse abdominis, TVA, and multifidus are deep stabilizers that help increase intrinsic spinal stiffness and resist segmental shear forces. jospt.org/2 Science Direct +2. Many individuals with low back pain have proprioceptive and motor control deficits in the lumbar region, meaning they have a diminished ability to coordinate and sense small spinal movements. MDPI+1. Core motor control training, especially exercises that promote coordinated activation of deep stabilizers, is a mainstay in low back pain rehabilitation. jospt.org+2 Science Direct. Pelvic floor contraction, coupled with TVA, is increasingly recognized in research to support lumbo-pelvic stability, particularly in women, but relevant in general. MDPI. How to do it, refined. Lie supine, knees bent, feet flat. Flatten your lower back slightly toward the floor, neutral. ... As you exhale, draw your navel inward, activate TVA, and gently pull the pelvic floor, as if stopping urine flow. Hold 18-10 seconds, or as long as comfortable without breath holding. Repeat 4 to 6 times. The feeling should be subtle, no big hollowing or straining. Key tips for lasting relief with evidence cues. Avoid long static sitting. Alternate positions. Stand and move every 30 to 45 minutes. Studies clearly show that static postures amplify lumbar disc stress. PMC+1. Prefer erect sitting over slouched or floor-sitting postures. Slumped positions cause higher stress on disc nucleus and annulus fibers. Finite element modeling supports this. MDPI +1. Incorporate motor control and movement variety. Rigid postures are physiologically unfavorable. Variability helps tissue health. JOPT.org +2, Frontiers +2. Address hip strength and mobility. Given that hip mechanics are altered in many with low back pain, working hips reduces compensatory lumbar load. Biomed Central +2 PMC +2. Target deep core and stability over brute strength only. Motor control exercise yields modest but consistent benefit in LBP trials. JOSPT.org +2 Science Direct +2. Improve proprioception and coordination. Many low back pain sufferers have impaired lumbar proprioception, so exercises promoting sensory feedback are helpful. MDPI. Progress gradually. This instant relief routine helps acute tension, but long-term improvement requires gradual loading, strength, and adaptation.